Renaissance Bank, and also our CEO, Clay Vandiver, when I say, how are you? Because if there's anything we're learning about in COVID, and doing virtual meetings is part of that, is are we taking care of each other? And so whether you're in crisis response, whether you feel like you're already kind of recovering from the craziness and uncertainty of the times we're in, or if you're already thinking in that forward look, you're rebuilding ramps for CASA clients, that's amazing. It's important for us all to do self-care during this time. And some of us are just used to running and never do that. But this is a time where it is so essential. So United Way, when you're talking about these three elements as a person, as a Rotary Club, as an organization like United Way, we are actually still in crisis response. We jumped in right in March when things started to heat up, and we haven't stopped since. But we're also looking up and out. We're a 77-year-old organization in this community, and we know that we are here for the long haul, whatever uncertainty still is out there about what that looks like. And so we encourage you to network and work with each other. And I love that you guys are going out and volunteering together, because that prevents this social isolation that can harm all of us if we're not careful during this time. So we really did want to start by saying, please take care of yourself. But I love this picture. And I'm going to see if I can just go way over there so you can see every single one. This is the portfolio of partners that United Way works with in our community. You see CASA on there. You see quite a few others on there that some of you may know, and a few that you may not know. So we always invite folks to come and learn what they're doing. These 27 nonprofits have United Way dollars pushed into 35 of their programs. And so we are supporting them year round. We've been doing weekly Zooms until June, just trying to get a handle on how we keep responding to need the way we always do together. And that's been fabulous, fabulous, fabulous. And so this is the core of our work. It's why we raise dollars in the community, so that those agencies have more capacity to serve, because they're having to spend less time fundraising. That's just the simplest way I could explain that. And so you'll get these slides in a PDF. So if you don't have a chance to look at all of them, then you can see that. Plus, in recent years, since about 2010, United Way has added several what we call gap filling essentials. I hope that everybody on this call knows 211. That's if you meet anybody in the community that needs help and you don't know where to send them. And some of you have been around a long time, so you know some agencies that help. But I bet there's not a person on the call that hasn't felt helpless when somebody comes to them and says, I need help with X, and you have no idea where to send them. Just remember those three numbers, 211. People can text into a special phone number, not dial the numbers 211, but you can call into 211, or you can visit 211connectsalabama.org and have a live chat with an operator that knows all the resources available in Madison County. And we are so proud that Alabama is on top in one way that we know of, and that is that we have 100% coverage in the state of Alabama for 211. So it doesn't matter if you have a landline or a cell phone or a computer, you can reach 211 if you live in the state of Alabama. And we're very proud of that. We had about, in the last 6 months or 12 months, about 12,000 calls come into our 211 call center and then get connected out in the community. We also are the home of FamilyWise. We want to make sure that you guys know about this, because especially in this last quarter of the year, we have seniors who are on a fixed income or on Medicare, but then they hit that point, and some of you know what this is. I know what this is. You hit a donut hole, or a place where you have to take 100% of the expense on for your medications. And many of our seniors on a fixed income can't afford that. Some of our single moms and dads have trouble with that. So this is a program that this year, after 14 years of having it here, if any of you remember Nancy Colon, who used to work in the position I'm in now at United Way, she's the one that brought FamilyWise here. And since 14 years, we have saved $2 million, now over $2 million, for people on the cost of any prescription medication that they're taking. So we want to be sure everybody knows about that. Born Learning is where our lovely little Jumpstart Read for the Record goes, and that's around young children, such an overlap with what Rotary does with literacy and children, and we love your participation. This year, it's going to be virtual, and I have a dozen brilliant community servants from the community that are meeting virtually to plan what that looks like. So we're going to use Cheryl Smith, our point of contact at your Rotary, to make sure you know how that's working and how you guys can be involved. It'll just look different than it has in the last 11 years. Last year, you guys helped us have 5,100 plus children and adults hear the same story on the same day. So kudos, everybody give applause to yourselves, because that was an amazing thing. We are also the home of Leadership Social Services, which is the only year-round professional development in the nonprofit sector locally, and our Leadership Youth Leaders Council, which is raising up our next group of philanthropists and servants in the community, high school kids. And so we love that. I'm not going to take, well, I will take a few minutes. Ride United is our newest initiative, and we are so thrilled to have support from Toyota to help us get people who have transportation barriers to pre-employment screenings, to job interviews, and then for a very short period of time, the first few days or maybe a week or a little longer, of a ride to and from work. So we can move those people away from a place where they can't take care of themselves to a place where they are more able to do that. And during COVID, thanks to the generosity of Toyota, we've been able to expand that to get people to food and to get people to essential non-COVID related health, dialysis and things like that. So it has been, many of you probably know what a big issue transportation is because our community is so spread out. So this has been a great, it's our initial year. We're the only United Way in Alabama running that program, and it's as simple as somebody can find out if they're qualified to get a free ride through a Lyft ride sharing, which is just, it's not a personal taxi, but it's a car that comes and picks them up and takes them somewhere and brings them back home. That is available through Lyft. And so we're thrilled with that. And I don't know how many people had heard. So when you look at that big core of work that we're doing with our United Way partners, and then you layer in these that really reach out beyond our partners to the whole community, then that's the essentials of the elements of what United Way is doing today. So what happened during COVID? I'm going to tell you this real quick, and then we're going to jump into volunteering. So we wanted you guys to see what we've been doing since March when we had to go home. And I've kind of been the holdout. This is my first full week back in the office. We're still not open to the public. We're still practicing a lot of protocol, but things have settled down a little bit with COVID. We hope they stay there. And so we're masking. I have my United Way mask here. You know, we're using hand sanitizer. We're doing all kinds of things to stay safe. And I won't go through all of this. Some of the programs that you heard about are mentioned on here. We are also very honored to be the recipient and administrator of over $200,000 coming into our community from FEMA that is dedicated to emergency food and shelter relief. And that has come at a really important time with COVID. That money is being allocated now. We have a separate board that reviews that with Stuart Sinyard, who's on the community impact side of United Way. And so those dollars go out and work to supplement the things that have been happening from other sources. We also have a lovely partnership with Public Supermarket Charities, and they have stepped in and allowed us through a special fund we have for employed people to help 54 additional families remain housed when they could have added to the homeless population here in Madison County by paying a month or so of their rent or utilities. So I know that's been like a wind tunnel, guys, of information. But we want you to know, and I know that Claudia echoes this message, we want you guys to know what we're doing. We want you to know that, yes, we're 77 years old, but we are not tired and we are not stopping. And we're leaning into this growth in our community and doing something about it. And so the big news is that just as of the end of August, that number is higher now. Our total impact has been over $1 million since mid-March. And so those are really big numbers. Don't let that make you think that United Way doesn't need everybody to be involved. That's why I love the name United Way, because we have a place for everybody. If all you can do is volunteer an hour a year, we're going to kiss your feet. And if all you can do is give, we have folks that are doing something at the ARC of Madison County. They are employed in very low, like minimum wage jobs, and yet they're given $1 a paycheck out of their paycheck to help United Way. Our needs are growing in this community. We're growing fast. And so we need everybody to be able to step up and do what they can. And I loved hearing what the Rotary has been doing. I'm going to give a shout out in relation to our campaign that's active right now. Our theme this year is Together We Can Create Hope. And I love that, because we need to be thinking about hope during this time and how we can reach out to those seniors and our veterans and those fragile children who didn't choose to live in poverty, and our folks that are trying to get that leg up so they can take care of themselves and their families. Those numbers are rising. And so that's why we are out there advocating all the time. If you have a company or you're an employee, ask if they have a United Way employee giving fund or an employee giving campaign. If they don't, call Claudia Bucher at United Way. And please, encourage them to be involved. The other thing I'll say, because there are some retired folks, I'm so jealous. I have about 3 years before I get there. But just because you've left the workforce doesn't mean that we don't want to stay connected with you. And we lose that connection because of the employee privacy laws these days. So if you used to give to United Way when you were working and you want to come back and talk to us about what's possible on the volunteer side or on the donor side, please call our office. And I've got contact information at the end. So now we're going to go to the meat of what you want to talk about, which is, did you know that people who volunteer are 42% more likely than people who don't to say that they're very happy? Rotarians are very happy, aren't you? Yeah, because you are serving already. But it's good mental health for us all. And as I said, especially during this time when we're dealing with COVID. So I have a couple of, we love pictures, don't we? So I have a couple of pictures here. And then I'm going to skip out of this presentation, show you what I sent to Elizabeth that you guys are going to get, that you can work on to find club and group opportunities, but also to find individual opportunities. So these are just a few pictures. This picture down in the bottom right is an amazing meeting that we had before COVID, so no masks. But this was employees from both the ARC of Madison County and Huntsville Utilities who came together, and they put packets, as you can see this lady right here, she's got a hold of one of them. Whoops. And what did I do there? I think I have to stop sharing and go back. Let me go back and do that. I apologize. I clicked too soon, guys. So wait, just give me a second here and I will go back and fix that. So, but that little lady that was right there is definitely one of our great volunteers from the ARC of Madison County. Oh, I just did it again. Well, we're just gonna, I'm not gonna worry about that. How do I go back? All right, we're gonna try this one more time, guys. I apologize. It's the technology challenge of the year, right? So let's see here. We're gonna go back here. And let me see if I can get back to it. Anyway, lots and lots of volunteer opportunities that you can take advantage of during this time. And there we go. Okay, now I'm back. Now let me see if I can come back and share, and we will be back on track. I apologize, guys, for that. But here we go. Let's try that one more time. I promise not to double click on it, which is what I did. There you go. Okay, So in the above that picture is Bancorp South, a lovely friend of United Way, and they did a supply drive during our Days of Action back in June when we collected more than 10,000 items to help our agencies so that they could keep serving in a very difficult and challenging time and didn't have to go buy hand sanitizer and wipes and all those essentials that we just have to have. So now I'm going to do what I was going to do, and I'm going to stop sharing this page, and I'm just going to share something out of my Word document really quick, because I want you guys to see the volume of what I put together, what we put together at United Way. Can you guys see that? Okay, so yes. Volunteering, I put a list of face-to-face things for you. And then we also put some virtual volunteering, because we know there are some folks out there that really, because of their age or their health or other situations, cannot volunteer face-to-face. And we respect that, but that doesn't mean you can't help. And you can see here that I'm gonna highlight that, our Jumpstart Read for the Record committee is gonna need people helping within that committee, as well as whatever we do with our everyday volunteers for that, which will be coming very soon. So that's a great way to get plugged in. And then there are some one-time opportunities that we've listed with United Way partner agencies specifically. Our first page really has both United Way partners and other nonprofits in the community, because the Volunteer Center of Madison County, which is housed with us, is a situation that is beyond the United Way partners. We have 27. There's almost 200 nonprofits listing their opportunities on the Volunteer Center. And so we want to connect the community with as many of those as possible. And then we listed a lovely group of agencies that have more than one volunteer opportunity. And the ones in bold are our partner agencies. At United Way, we gave you a phone number, so it'll be easy to contact them. So that's my gift and United Way's gift to all of you as part of what we're doing in engaging the community and getting them involved. Now I'm going to go back to the slide that I kept popping to. So use your brain. That's a great way to volunteer. We need lots of brains. The more, the better. And I love this picture. Be flexible. Talk to an agency, and if they don't have exactly what you have, tell them what you can do and see if they don't need it, because sometimes that's the case. So we are going to current slide. Yeah, okay, there you go. I'm not going to touch it, guys. So you guys are already superheroes in the community with all the service that Rotary does, but we want everybody to know that there's a place for them to plug in, and that United Way can help with that. So that's just a reminder there for you. And if all you can do is be an advocate, remember I mentioned 211, that anybody can share 211 in the community, even if you don't know the answer to this person's question. If there's a resource that exists in Madison County, it will be on 211. And so please, 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 help share that. That's a constant marketing thing that we have to do. We're not going to spend bukus of money to have big flashy billboards and high cost commercials on TV, because we want our money to go to help people. And so we need advocates and folks that will speak up for that. And then I gave you all the contact information you could ever want. We hope that you'll follow us on Facebook at UW Madison County. You can call our office. We are open only at the outside in our outer lobby, but you can stop by there and pick up FamilyWise cards or information about 211. Volunteer Center is online. Claudia's there, and I put her number if you're interested in talking about how to help us raise more dollars to respond to growing needs, and I'm always here for you. So I thank you guys so much for allowing us to come. And I was just going to see, I guess, if we have any questions that we can help with in the few minutes that we have remaining. Let me see if there's something in the chat. I see a new chat here, but I don't know what that says.
Kathy,
so,
thank you. Thank you very much.
Robert was trying to help me, and I didn't pay any attention. Thank you, Robert. I appreciate that.
So, Kathy, thank you very much, first of all, for presenting to us. That's a ton of information, and I've already asked Jim TV to forward the information out that you sent to me, so it will go out to our members
Okay.
right away. Um, can you give us a sense of the, don't have my camera on, sorry. Can you give us a sense of the impact with your partner agencies? What has been the toughest thing for them or toughest challenge, and how you and your partner agencies has overcome that
Okay.
with respect to COVID-19?
That is a great question. I will tell you, I want to brag a little bit first. When it hit and everybody had to shut down because of what the governor did, I was never prouder. I went in a room and cried at the just the awesomeness of what was happening. We only have one of 27 completely closed for more than just a short period of time to make sure they were sanitized and you know, could do what they needed to do. And that was the Community Free Dental Clinic, because they serve a very fragile population, and their dentists are also elderly volunteer for the most part. So the Dental Association told them, you cannot be open, and they respected that, and that was the right thing to do. Mm-hmm. Everybody else was either going and looking at policy, following what the CDC said, and any other advocates, Hudson Alpha, anybody else that could tell them the reality of the medical situation as we knew it at that time in order to keep serving. And so I'm going to shout, since you guys know CASA, I'm going to tell you a little quick story about them. So they did have an active case early on, and they shut down and sanitized and allowed that person to be quarantined, but then they were right back up. The day one, they were calling every single senior that's in their database to check on them and make sure they were okay. They could do that remotely, even as they were closed to the, you know, to anything else. And now they have, I was out the other day and saw, you'll see a picture on our Facebook page if you go there, but they are very strict. And you probably saw that, the ones of you that volunteered with them on the ramp building. They're very strict about keeping everybody safe. And that's just one example. Boys and Girls Club could not have their clubs open, so they started feeding their kids because that was a big issue. And I could just tell you 27 stories or more about that, but that's just two great examples. And I'll mention a third. The Y, again, could not be open for fitness or for their childcare programs and after school and athletics and stuff for the kids, but they went and helped with the feeding program in the county. They had a brown bag bus feeding program that was going on, and United Way, with our COVID-19 dollars that we were able to raise, which you can see on that spreadsheet, we were able to help them with that. So Claudia and her team raised $173,000 currently to help, and that got multiplied through the partnerships and everybody else that we have to be that over $1 million impact. So the biggest challenges are, quite frankly, it's expensive to do all the safety and protocols that they're doing. So their everyday operations cost more. And that's why we had our day of action where we collected items for them. I just did a poll for them, and I'm ready. If anybody wants to run a supply drive like you guys are doing for Mountain Gap, we will have ready lists by either the kind of categories of stuff or by agency that the community can access, because every penny we can save them with PPE materials and those kind of things, they can then fuel back into the work that they're doing. A lot of partners are serving more, even if they're serving a little bit different than the ordinary, they're serving more people. Manna House has had record numbers, and Manna House worked with Huntsville City Schools with their feeding program. So they've been in the middle of it. I can't tell you how proud we are of what they're doing. And so we did everything we could to make sure they had information when it came time for the PPP applications for loans to help them financially over this. We made sure they had all that information. We provide sales tax exemption to all of them, and so that's helping them. So but I will tell you what I think the greatest challenges are. We can't, as the nonprofit sector alone, solve every problem for every person that's facing something in COVID. And so we have a great group of partners and we're working very hard, but it's going to be more costly, just like it is for our schools, in order for them to not have to serve less people as these demands are out there. And so the more advocates we have in the community that can share those great stories of what they're doing and how they're responding smartly and intentionally and not just like panicking, you know, is very, very important. We are seeing, you know, United Way released last year our needs assessment, and we already knew that affordable housing was an issue. We knew that transportation was an issue, but those monsters have raised their ugly head on a whole new level with COVID.
Right.
And so we have a lot of people, you know, that it costs $800 a month on average for somebody to live in a 2-bedroom apartment in Madison County. That's not affordable for people making, you know, minimum wage, even if they're working 2 jobs. And so that's a challenge that was big before COVID, and now it's bigger because more people are not able to pay their rent and utilities. Maybe not at fault of their own. Maybe they didn't get the stimulus because of some, you know, technical piece. So our partners, that's all I can say. They are just working really hard, but they need us as a community to wrap our arms around them. And I will tell you, I don't think this is prejudicial, but our partners are selected very carefully from community members that help us do that. And they are the best in the business. And so if we want to make sure that good best practice services are happening in our community, then United Way is a great choice. And I say that as a donor myself. You know, it's a great place to invest in the future of our community, because this could be a place where we turn into a city and a county we don't want to be, as we're growing really fast, and then we've got COVID on top of it. So that was a really long answer, but very, very important information.
Okay. Well, I do
Elizabeth?
have one. Yes, go ahead.
Oh, I was just going to share. You probably saw that UCP is also a United Way agency, and a little bit of a different perspective of how we're doing things, trying to meet the needs of our clients, but the challenges. When the pandemic hit, organizations like United Cerebral Palsy were granted permission to use telepractice. That was great for our babies, where we teach parents how to work with their young child with a delay. And to an extent with our therapy patients who needed physical, occupational, and speech therapy by doing telepractice. We couldn't collect co-pays or do anything else, but we could at least bill for those services. Now, all of our contracts, as you would expect, if we do not provide that service, we're not paid. So the reality now is everyone's tired of either Zoom and telepractice appointments. They're going back to work. They have children using those devices and their time during the day for school. We have families constantly calling to reschedule, taking a lot of time to reschedule and figure that out. But they've either been exposed or have COVID or have some reason that they have to cancel. Every time my staff is potentially exposed, I have to sit them for a couple of weeks. All that time, their salaries are going on, but no billables coming in. So I think the real challenge is people are getting so numb to the Zoom and the telepractice, and it's worked beautifully to a point, but now life is zooming by, and it's getting more and more of a challenge to deliver those services in that format, particularly if we have to cast or teach feeding or use our big devices to teach a child to walk. They have to be in center. So agencies like ours that are very hands-on with their clients are trying to figure out that piece on how to resume some normalcy. When with the cleaning protocols and the temp checks and everything, we've already lost 1 appointment for every 2 we think we have on the books just for the safety protocols. So we already know our income's down 1/3 if we never had a cancellation. So I'd be lucky to collect 1/3 of what I used to.
And I would tell you something else that's related to that is many nonprofits in the community in general, and certainly our partners, usually have fundraisers to supplement what they're getting from grantors like United Way, and those have had to be canceled you know, because they couldn't have them. And so that has really put another kind of stab in the income side of things when they've in fact been delivering more services. I love Patrick Wynn at the Boys and Girls Club. He said it's about the kids. It's got to be about the kids. And I'm going to do whatever I need to do to be about the kids. Boy, that gives me chills just saying those words. But that's the attitude of those beautiful community servants that are out there working with United Way, for sure.
Yes. Well, does anyone else have any other questions?
I do. Kathy, could you, if you have available, what are the top 5 calls that go into the 211 call center?
Okay. I'm going to show you guys something online. Okay. Just real quick here, if I can. Let me see if I can. First of all, I got to get out of my screen and go so I can actually call up. There's a website called 211counts.org, and I'm going to call it up right here and open it up to the state of Alabama. And and thanks to your United Ways across the state, this is available. And then I'm going to, just give me a second here, I'm going to search for Madison County. So we're looking at Madison County data. This is so helpful to us, and I'm so glad you asked that. I'm going to do for the last 30 days. Let's do it that way, okay? Now, let me hop back over to Zoom and see if I can share this, and we will see. Now, oh, there it is. Okay, so can you guys see that?
Yes.
Awesome. Okay, so this is 211 Counts, Alabama. I could choose the county. You can choose zip code. You can choose congressional district. You can drill it down, or you can look at the whole state, and you can relate it to how long. Okay, so in Madison County, let's just move it over to the count. That'd be easier to see. Okay, so you can see here what the big calls are coming in, and this is historic with us, but these numbers are bigger than usual. People are calling for help with rent, food, housing, and shelter. Those are the #1 calls we get. But this one, transportation assistance, is also up. And then this is really cool. You can click on the one and see, okay, what kind of help within that major category are they calling for? And here's a gap, guys. See this? Unmet needs. 13% of the people calling for home repair and maintenance. We didn't have a lot of calls there, but 13% of them could not, we couldn't find an agency or a group to send them to. That's one of the challenges we have. The city of Huntsville has some money for community development that helps with that kind of thing, but there's the liabilities around people doing something out of the goodness of their heart. It's just a very challenging environment. And then
what is the other?
Other housing or other?
Other.
Yeah, so I clicked on here, help with general information and referral, complaints, government, community enrichment, volunteering, donations, support, advocacy, and special population services. So, and these categories came just from our history of knowing what kind of calls come in across the state of Alabama and across the country, because this is a national program in terms of numbers. So then if we go back and we do all, I take Madison County out, then it's not going to let me do that. Okay, all. Yeah, I have to choose all. Okay. Then the state of Alabama, then you can see there. And look, it's interesting. It's many of the same, although we're seeing a jump in disaster right now because of the hurricane.
Right.
Yeah, but you can drill down into any of these and see what's behind it. And I love that. And we use that at United Way to help figure out, you know, what we need to respond to.
Okay.
So that's
an excellent tool.
It's a great tool. We love it. And it's a public resource. So anybody can go on there and look at any time.
Okay. Does anyone else have any other questions?
Ms. Miller, this is Rudy.
Hi, Rudy. What can I do for you?
We spoke about transportation, you needing some buses. I hope you got that straightened out. I also shared with you that St. Vincent de Paul and Catholic Center Concern certainly serve on those 3 priorities that you mentioned. Mm-hmm. When I first joined these service organizations, I used to carry with me a little yellow book that you provided, is that back in publications or are you going automated?
Well, I tell you why we stopped doing that. And it's very pragmatic. It's because by the time it's published, it's out of date. You know, we have so many people, but that 211connectsalabama.org is the public online version of the Yellow Book. And we have taken the time for our first responders, our police and firemen, to give them a little trifold that's got the essentials in it around domestic violence and some other key issues, hunger and homelessness and some other issues in our community, so that those frontline folks always have that information. But 211 is always a call, a text, a chat away. And so we're really trying to push people to not be dependent on the book, but to call just because the information's changing. You can imagine in COVID, one day an agency is open 1 day a week, and the next day they're open 6 days a week, you know. And so especially now with what we have, it's a real challenge. I do know in my volunteer list that CASA is looking for volunteers to go drive supplies out safely, and they have a really good protocol for that, you know, to get things to people that can't come in and pick them up themselves. So I do know that transportation, and Ride United is filling a bit of that transportation gap that you mentioned.
Okay. All right. Well, thank you very much, Kathy. Again, tons and tons of information, and I appreciate you sharing the handouts that will go out to everybody. So it was great to see you, great to see Claudia, and we look forward to working together now and in the future.
Jumpstart is October 29th.
That's right.
So look for information. We'll send it through Cheryl.
Yeah, we certainly will. All right. Thanks again. And now we are ready to close our meeting. So I will now share my slides with you, my last slide with you, I should say.
Elizabeth, I just want to say what a great job that Kathy, Clay, and Claudia are doing, and their whole team over there during this pandemic. Great job, and kudos, ladies.
I couldn't agree more. We really do appreciate all of you do for the community, and like you share the same desire to help people in any way possible. So we really appreciate all the work that you do as well. So now we are ready to close out our meeting, and it's time for the 4-way test. So if you would unmute your mics, please, and then if you would repeat after me. Of the things we think, say, and do, number 1,
is it the truth?
Number 2,
is it fair to all concerned?
Number 3, will it build
goodwill and better
friendships? And number 4, will it be beneficial to all concerned? Oh, thank you very much for joining us today. We had a really great attendance, really great turnout. I look forward to seeing you all next week if I don't see you or hear from you before then. So please, everyone, please stay safe and healthy. Take care. Bye-bye.
Thank you,
Bye.
Kathy.
Bye, everyone.
You're welcome, Beth.
Bye.
Bye.